We are taught to look for our heroes on the page and on the screen. They teach us that good always finds a way to defeat evil, that justice and fairness matter. But eventually, we grow to understand our heroes are fictional, and unfortunately, so is the just and fair world they exist in. There aren't costume villains in our world either, but that does not mean we are without our own challenges, our own foes, the kind that have the power to take everything from us. And while some foes can affect us all, the undeniable truth is they do not affect all of us equally. In our fight for a world without cancer, it's clear that the fight is not a fair one. Success in your battle with cancer should not be determined by who you are and where you're from. And while our movie and comic book heroes and the fair and just worlds they exist in might be fictional, we believe they hold a lesson for us, that there can be justice and fairness in our world if we're willing to fight for it. We are. And today we're asking you to join us. No need for superpowers, alter egos, or capes. Just the courage and the will to do what's right.
Thank you so much for being here today as we kick off the launch of the American Cancer Society Hero Campaign. I am excited to serve as your host today. Let me introduce myself. I'm Anne Marie Wallace. I'm a System Community Outreach Coordinator for Baptist Memorial Healthcare. I work in outreach over a 3-state area with a focus on bridging health disparities. Programs that fall under me are Baptist Operation Outreach for the Homeless, as well as our Baptist Healthy Communities. I'm so happy to be here. And before we get started, I'd like to acknowledge our presenting sponsor, Caesars Entertainment. Thank you for your support. HERO is a movement to ensure that everyone has a fair and just opportunity to prevent, find treatment, and survive cancer. The American Cancer Society goal is to reduce cancer deaths by 40% by 2035. But to make this goal a reality, we must all work together to work on disparities that exist in cancer diagnosis, treatment, and survival rates. Cancer is a disease that affects anyone, and it doesn't affect everyone the same. For instance, breast cancer mortality is 40% higher for Black women versus white women, despite the incident rate being similar. People who live in the poorest areas have approximately 20 to 25% higher cancer death rates than those that are in affluent areas. And those are just a few of the stats. I can go on. Structurally, racism, education, access, all can be positive or negative outcome factors. For instance, 12% of Shelby County residents under the age of 65 have no insurance. Well, with no insurance, the impact of being diagnosed and getting treatment, your rates for having cancer and other health disparities are going to be higher. Together, we can leverage our power and our resources to fight for health equality, to decrease cancer mortality, drive healthcare affordability, also make sure everybody has high quality treatment, and ultimately strive for a world without cancer. The only possible way for us to find a solution for these disparities is really to work together. As partners, neighbors, leaders, business organizations, government partners, hand in hand, we can solve this. Today, we will hear from our panel experts who will discuss some of the health efforts that are going on in our community. At this time, I'm excited to introduce one of our first panelists. Her name is Dr. LaTanya Washington. Dr. LaTanya Washington is a physician advisor of St. Francis Hospital, Memphis. She is a specialist in internal medicine and pediatrics. She also serves as the current president of the Bluff City Medical Society and co-chair of the Memphis League Heroes campaign. She is passionate about identifying and improving inequalities through improving health literacy, healthcare access, and improving diversity of healthcare by increasing the numbers of the underrepresented minorities in medicine. Welcome, Dr. Washington. Next, I would like to welcome Dorothy Toller, who is a 2-time breast cancer survivor, still undergoing a 10-year treatment plan, and an American Cancer Society Community Health Advisor. Dorothy is trained in grassroots advocacy to fight against cancer, providing information and resources for the prevention and early detection of cancer in our underserved communities right here. Welcome, Dorothy. I'd like to also introduce Jonathan Lewis. Jonathan Lewis is the Director of Community Partners in the Mission Integration Division of Methodist Le Bonheur Healthcare and the Director of Congregational Health Network. He is a board-certified chaplain in the Methodist United Ministry, a healthcare leader, and a teacher. Welcome, Jonathan. And lastly, I would like to welcome Benjamin Jabbar, a native of Memphis who has always had a passion for healthcare and currently works for a tech firm, Bioventus. Exploring the streets of Memphis and Guatemala in his youth, not only taught Benjamin about Spanish language and the Hispanic culture, but also about the desperate healthcare outcomes faced by communities of color. I'd like to welcome all of you. You have a distinguished background, and I applaud you for the work that you do in the community. So at this time, let us go on and jump into the first question for today. According to the American Cancer Society, African Americans and other racial and ethnic group people who have low incomes or are underserved or underinsured people live in rural areas often face greater obstacles than others. How do structural racism and inequalities contribute to cancer disparities? Why don't we talk with Dr. Washington first?
Sure. So I think it's important for us to understand that structural racism is something that's very real here in our country and in our community. When we talk about structural racism, we really have to think back to the origins of racism in this country. We have to think about the living conditions of underrepresented minority people groups, Black and Brown people. We have to think about the access that they have to healthcare. I would say that's a huge part. But then we also have to kind of take a step back and think about the education that is required for individuals to even know that they should seek healthcare and the concerns surrounding that. We've really had a number of individuals, we've heard that more during this time, that have serious concerns that they may not be treated equally or treated fairly when they choose to seek healthcare. And so that's a big concern as well. And then going on to access, you stated earlier that, there was about 12% of our population who are uninsured. So of course, when someone has a health condition at home and they know that they don't have health insurance, then that's a concern for them going forward to even try to seek health care because they're concerned about how much it's going to cost. Or they may be concerned that they can't miss work, so they can't seek that health care because then they won't have income. So all of those things are really important when we talk about structural racism. And I think we'll probably talk a little bit later on about some biases involved in the healthcare delivery system.
Thank you very much. I'd like to jump to Ben and see if you would address that question.
Absolutely. The doctor touched on some very important points. A lot of these are social determinants of health factors we're dealing with here. These are cultural, linguistic, and even geographic limitations that we're dealing with here. And I can speak to the Hispanic population in particular. Over the last few years, been a lot of trauma been going on in the Hispanic community. A lot of nervousness for various reasons, as you know. But one of the things that we always have to think about is a lot of these people that are coming to this country, they're not familiar with this healthcare system that we've built. It's a bureaucratic morass in some cases, and most people that even speak English and have lived here their entire lives, they can't navigate it without either a law or an accounting degree. So we've got to really focus on that education portion, like the doctor said. But what's really important, and this is what Baptist did really well with what we did this year. As you alluded to, Anne Marie, we had some grants to get mobile mammogram screenings. So we got to do a very boots on the ground type grassroots campaign. It's still going on. It's still very successful. You really have to go into the neighborhoods and have a cultural understanding, or people won't really respond well to you. So those kinds of programs are really what we need to encourage. As far as the financial aspect, it'd be very good if we could expand Medicaid. A lot of people that are undocumented have that fear. And if they had some kind of coverage, I think they'd be more open to going and seeking preventative care. And that saves our system a whole lot of money, as you know.
Right. Very good. Jonathan, will you please address the question?
Sure. I don't know that I could really add much to what Dr. Washington and Ben have just said. They certainly used some of the words and ideas I was thinking of, including the social determinant of health and all that those have to do with cancer disparities, and also just access. I think, we're talking about that question: how do racism and inequality contribute to cancer disparities? One thing is, first of all, can you even get there? Do you have the resources, the access, the education, the support from people in your family, friends, community, people from your government and from your healthcare providers? Can you even get to the place and the people that are necessary for you to have the care? A lot of that depends on social determinants, and a lot of those social determinants in our communities now are unequal. Then, if you can get there, what happens when you do? Are you treated fairly? Is there bias that's present in one or more of the providers that are treating you, in the payment and financial system that's often very biased and hard to navigate in American healthcare? So I said I won't go on, so I won't. But
that's a good point. And that's a good lead in to Dorothy, because Dorothy is working with patients on a grassroots level. And I would like for Dorothy to respond to, what are you seeing with that racial inequality? How does that contribute to cancer disparities?
Well, I have Latina friends won't go to get their mammograms or PAPs because they don't have insurance. I have African American friends that won't go because they are in fear. They don't have rides. They have all excuses. So with our CHAR program, which we'll get into that later. Those are some of the things that we do to help individuals get back and forth to the doctors and get the information and get the rides that they need to get to the doctors.
Let me ask you, what are some of the best ways to reduce cancer racial disparities?
I think that some of the best ways to reduce cancer disparities is to spread awareness, to go out in the communities, to set among the people that are afraid to go to the doctors, to see what they need as far as help is concerned. Because a lot of them don't have rides, as I say, don't have rides, they don't have insurance, they don't have family members to support them. So it's really difficult for people that don't know where to go to get help from.
That is a good point. I want to go back to Jonathan because we both have similar programs with Baptist Healthy Communities. You've got Congregational Health Network. Can you address some of that, in terms of the best ways to help to eliminate?
Right. Yeah, I'm glad you mentioned those outreach programs that are in our community, because that is one of the really important ways to reduce the disparity, is to try as much as you can to start to put a dent in some of those social determinants by increasing access, by increasing education and awareness, as Dorothy said, and those community outreach programs can sort of, get the ball rolling on that, a bit. I think another important, piece of, reducing the disparities is having honest conversations in the first place about the fact that the disparities exist. Some of those conversations are harder to have in certain places than in others, but I think the more that you can get that out in the open and have sort of honest dialogue about the existence of the disparities and the inequalities and the racism, you can start to affect change there. And I think one other thing I would point to quickly is encouraging diversity in the people that you're having conversations with, encouraging diversity in the clinical setting, in the healthcare environment. Do you have a diverse workforce that can help with some of the things we're talking about, conversations about inequality and about bias.
Very good point. I'd like to go to the next question and start with Dr. Washington. How do you think that we can all work together to increase awareness to help eliminate health inequalities and disparities in Memphians?
I think that, a lot of the things we've already talked about, education, that is key, making sure that everyone understands the importance of undergoing cancer preventive screenings, making sure that healthcare providers understand that there is a disparity there and that people of color are affected disproportionately, and really having a keen eye to say, this patient that I am viewing as a person of color, they may be uninsured or underinsured. And what is it that I can do as a healthcare provider to make sure that they feel seen, that they feel heard, and that we're addressing their cancer screenings at that point of contact to make sure that they're not lost. Because when we think about people who are uninsured or underinsured, oftentimes, if they come to the doctor's office or go to the hospital, you really kind of have that one shot because they're not really going to try to come back and forth. So getting them plugged in with those community services where they can get, a free screening mammogram, or making sure that you educate them about getting pap smears, getting colonoscopies. Those are the things that are really key for making sure that we increase the awareness.
Great point. Ben, would you like to address that? How do we together work on this? You have some ideas?
Oh yeah, I've been doing this for a little bit. One of the best things to do is to get community influencers. If that's a pastor at a church, that's good. Community leaders, politicians, an athlete. Once they're given the messaging, it gets a little more traction, in my opinion, and it really really appeals to a broader demographic. So that's been successful with me. That's what I was doing when we were dealing with testing and vaccinations. Got to get somebody that's trusted in these communities. Another thing is putting on health fairs, and people can make appearances of these as well. But you have some giveaways. You have the providers there, and it's a really good thing, especially if you're going to the Hispanic neighborhoods and conducting them there. Just like Johnson, you have to bring it to them. So those are two tactics that I've really found to be successful.
Very good. Dorothy, would you like to also address that question? How do we work together?
Yes. Well, we need a community-wide effort. Hospitals, as Ben says, service organizations, community organizations. We need political makers, and other community organizations to come together and develop a plan and a pool of resources to implement programs and services to reduce and eliminate health inequalities and disparities in Memphis.
Very good. Jonathan, would you like to also add to how do we work together? I'm sure like you and I'm often on committees that consist of about 20 or 30 people, and it could be the Memphis Breast Cancer Consortium that includes people from every organization as we're sharing about what events we've got going on, where are we working, or if there is one big event, how can we all take pieces of that event and really try to service the community. And even when we do larger events, how do we move it around our community so that we're meeting South Memphis, North Memphis, Hickory Hill, Summer Avenue, all these different areas. Yes.
Yeah, that's it, Emery. You said it perfectly. In that community partnership world, the whole purpose of having all of those partners together in so many of those meetings is that every single one of them brings different strengths. They bring different, relationships in different parts of the community. Even as Ben was saying about sort of the influencers, a community pastor will be influential with a different population than maybe an athlete would, or maybe a prominent physician would. And sort of having all of those folks on board, just relying on the many different strengths of community partners, I think is a tried and true approach.
Right. And I think many of us have worked with even the Church Health Center on various areas. And so for me to have Baptist Healthy Communities, I know when putting it together, I didn't want to duplicate what Church Health Center was doing because what they did was very good. Regional 1 also has their health outreach, and I go to their meetings and didn't want to duplicate what they were doing, but I did want to say, hey, how are we doing things and meeting niches and different things so that we are out there and working together, because I think I say there's enough work for all of us. And if we could get everyone to get to, we really don't have enough providers, is the truth, to see everybody if they were coming. But we would love for everyone to get to a provider because we know that early detection is key in that. Yeah. So I'll go to the next question. Dorothy, what are ways that the CHA volunteers help reduce health disparities in the area of Memphis? What do you do?
We have volunteers in Fayette and Shelby County. Fayette is rural. Shelby is metro. Gaps in health are large and cancer mortality rates are high. Community health advisors who are trained community volunteers impact cancer through education, screening, and access of care. We motivate others in the community to take health-related changes and give them the support to make those changes. We direct individuals to low-cost or no-cost cancer screenings. We have mammography buses screening around underserved areas in the community. We also address the barriers to care, to screening, to such as transportation, medication, utilities, no insurance. And then also we address the fear and myths about getting your cancer screenings. And then not last, but at least we go out and we make sure that we check up on, follow up on individuals who are supposed to be getting screened, and make sure that they keep their appointments for their screenings. And those are the things that the CHAR volunteers work toward in helping individuals to do.
Thank you. Well, as you saw, CHA is one way that the American Cancer Society is working to address health disparities and doing an awesome job. But at this point, I would like to have some closing remarks by all of our panelists. This time, let's start with Dr. LaTanya Washington. If you would give some closing remarks, and then we'll go to Ben, Jonathan, and then Dorothy.
So the one thing that I would really just like to close on is that I think that American Cancer Society is really doing great work. We see the community involvement from all the individuals that are present here on this panel. Certainly the CHA program really does offer meaningful resources to patients that we may not be able to reach. I know for me as a physician, I'm in the healthcare field. I may not be out in the community. However, when I do interact with people, I do tell them the importance of screening. But for individuals like Ms. Dorothy, who are cancer survivors, who are boots on the ground going into the community, certainly I applaud her efforts. I applaud CHA's efforts, and we have to keep doing the same thing. You know, our goal is that no one would die of any type of cancer. We have a long way to go to achieve that, but again, we continue to work towards those goals.
Ben?
All right. I think that we're going to see an improvement in outcomes once we have more of a unifying message. For a long time, we've been divided, but I think we need to see some more interaction and partnership between neighborhood communities, NGOs, African American community, Hispanic community, Asian community. I think that when that happens, we're going to see a lot better outcomes right now. A lot of these problems that we deal with in our society, they all stem from poverty. So I think as we improve this education and development, we're going to see a much better medicine.
Thank you. Jonathan?
Yeah, I mean, one of the very big tasks is just making people aware that there is a problem. You know, when we're talking specifically about inequalities, about disparities, you know, I think everyone knows what cancer is and knows that cancer is a problem and that we need to be doing things to address the, you know, physiological causes and treatments of cancer. What not everybody knows is some of these disparities that we've been talking about. Many do, but many do not. And you know, I think we clearly still have work to do. That's something that the American Cancer Society is very involved in. That's what the HERO Initiative is all about. You know, we still have a road ahead of us in terms of just making people aware, you know, that these are major issues, that access is not available to everyone, that, you know, the issues of being uninsured and underinsured are probably much more widespread than people know. I think Ben brought up earlier, you know, the piece about Medicaid, and that's not been expanded in Tennessee, and the battle that's been over that. There's a lot of things to talk about, but I think conversations like this one are very important, and you know, we need to raise the awareness as much as we can.
Thank you. Dorothy?
Yes, I would like to say that because I've had a lot of contact with people that did not get treatment for cancer and they passed away because they didn't know how to get information. They didn't know how to get treatment. They didn't know how to find a place to start, because CHAR has a lot to offer. They have mammography buses for like I say, for no income people, for low-income people, for Hispanics, for Africans, for Americans. So they have the revenue. We just have to direct those people. And that's what I do when I go into the community, direct them to people that has resources that can help them to get past the fear of I may die of cancer, any kind of cancer. So that's what I do. Go in the communities and make people aware of the revenue that we have to offer for them.
Well, thank you all. You've done a great job in sharing what you do, your passion. And I think when passionate people are out there for a cause, then we together can help to really, cancer we need to help to reduce cancer, that 40% death rate. And I think by working together and touching lives one by one, and making sure that they hear from people they feel comfortable from and look like them, then we'll achieve that goal. We heard a little bit from Dorothy about how she is involved in the American Cancer Society CHA program. She serves as one of the 83 CHA volunteers across 12 zip codes that serves as a boots on the ground grassroots cancer advocate group. Now we'd like to take a quick look inside that program now.
I think it was 2014, the Avon Foundation had done a study.
Memphis was ranked #1 in the nation for the highest mortality rates of breast cancer in African American women.
The one inspirational thing that my mother always says is to just keep living, just keep living. And she says it in such a jovial way. We're like two peas in a pod. About 20 years ago, my mother was diagnosed with breast cancer. My mother is a hero to me because she is a survivor. She persevered, she kept fighting, and she makes me understand that giving up is not an option. There's a brighter day.
These ladies, Annette and Daisy, they are dedicated volunteers of the American Cancer Society. They're grassroots, boots on the ground cancer advocates. That's what they are.
When it comes to awareness and prevention, I think that the American Cancer Society is just awesome as for helping us to get the resources to the community.
The HERO initiative, to me, it demonstrates that the American Cancer Society is working toward ensuring health equity. Unfortunately, there are many barriers in the communities.
A community member might be struggling with something as simple as food. Well, they can't think about that they need to do something for their health, and it's heartbreaking.
And education is a huge barrier.
Community members might not be as knowledgeable of what is going on with themselves. And if you let too much time pass, cancer doesn't wait on us. It keeps progressing and going its own way.
Everyone wants to live in a healthy community. We are all working together for a common goal, health equity.
As you just saw, CHA is one way the American Cancer Society is working to address cancer disparities right here in Memphis. This is one way your involvement in the League of Heroes campaign supports health equity right here in this city. Dr. Washington, I'll turn it over to you to close us out today.
As you can see, the American Cancer Society is really doing great things here in the Memphis area. Thank you for joining us today. If you are interested in becoming more involved in the American Cancer Society HERO program, whether to be involved or to donate, visit the website listed on your screen now. Thanks for joining us.